I'm working with Leprosy Mission Bangladesh. Today I will talk about digital complication care for people suffering with leprosy complication. About 15,000 people suffering with leprosy complication need expert care. It is provided by 6 leprosy hospitals located in 5 districts. Persons residing in other districts need travel to get these services. The purpose of this initiative to serve most vulnerable people suffering with leprosy complication and living far from the service center. We are trying to use modern technology to serve those people and engage their family member for future care. Let's hear the experience from participant and doctor.
ঘরে বসে আলসার সেবা পাইলে আমার জন্য খুব ভালো হয়।
বাড়িতে আইলে চিকিৎসা করলে ভালো হয়।
আমি প্রতিবন্ধী লোক, আমার হাত পায়ের সমস্যা, আমি গাড়ি তুলতে পারি না।
আমার শ্বশুর চিকিৎসাটা বাড়িতে করলে আমাদের জন্য সুবিধা হয়।
আমার সাথে লোক যাওয়াইয়া সমস্যা, টাকা পয়সা নাই, আর ওখানে আমাকে চুরি কে খাওয়াবে?
যাতায়াত করার জন্য আমরা যদি যাই আমার কাজের ক্ষতি হয়। মেডিকেলে গেলে সময় লাগে, পয়সা বেশি লাগে।
রোগীদের মধ্যে সচেতনতা আসবে, অল্প সেবা পেলেই তাদের রোগ ভালো হবে। অনেক রোগী দিন আনে দিন খায়, এজন্য তারা হাসপাতালে যেতে চায় না।
Persons who are suffering from leprosy complications especially are elderly, women and children. Many are living in hard-to-reach areas with challenges in mobility. Experts and health service centers for leprosy complications are very limited. Families are unaware and incapable of taking care of the patients. Regular follow-up will sensitize them to develop preventive behavior of practicing self-care. As a result, ulcers and disability will be prevented. We will follow up all the grade 1 and grade 2 patients.
We are using most common and popular mobile-based platform like Imo and WhatsApp to connect with people suffering with leprosy complication, their family and a leprosy expert. We also try to engage family members and local leprosy people's organization for future follow-up and support. As part of regular follow-up, local leprosy people's organization and their staff can help the family through connecting their smartphone and video call with leprosy expert. They can also support to the vulnerable people by providing essential materials for complication care. Nowadays, most of the people using mobile device, network also covered most of the location in Bangladesh. This is the first time in Bangladesh we are using mobile technology to serve people with leprosy complication and digitally manageable. We introduced these services during COVID-19 due to movement restriction, isolation, hospital admission of people with leprosy complication has dropped up to 60%. This has pushed us to go out of traditional complication care. Based on our learning from piloting during COVID-19, digital complication care minimize patient travel expenses, strain and increase participation and engagement of family in patient care. It also improved the frequency of follow-up by expert and encourage the family member and person suffering with leprosy complication for self-care practice. As 120 participants received leprosy complication care from expert during COVID-19 with the support of LPOs. We believe it is scalable and will contribute reducing the complication burden considering the mobile network, LPO location need and vulnerability of people suffering with leprosy complication. TLM has leprosy expertise and strong relationship with its community, other actors in its 36 working districts. We are working with 1,500 self-help groups, 18,000 members and 100 federation for mainstreaming people with leprosy, leprosy-related disability and people suffering with leprosy complication. We will collaborate with ALO-Society and its local federation. We have strong coordination with the National Leprosy Program and other ILAP members in Bangladesh. We have learned digital complication care from our practical experience. Thanks.